Well, hey, everybody, this is Robert, and welcome to today's show. Now, glaucoma affects over 3 million people in the US and is often called the silent thief of sight because it robs people of vision slowly and without any symptoms. January is Glaucoma Awareness Month, and that's a great time to emphasize the importance of regular eye checkups for early detection of glaucoma and other eye diseases. Well, joining me today to discuss the ABCs of glaucoma and the importance of this awareness month is Dr. Laura Sperazza. Dr. Sperazza is the Director of Vision Rehabilitation Services at Lighthouse Guild. Dr. Sperazza, welcome to the show, ma'am.
Thank you.
Let's go ahead and just start out with the basic. What is glaucoma?
Well, glaucoma is really a group of eye diseases. It's typically associated with an elevated pressure inside the eye, which would damage your optic nerve and gradually steal your vision without warning. It is the leading cause of blindness in the United States and accounts for over 80 million cases worldwide. And as you said, it's referred to as the sneak thief of vision because often there are no symptoms. And once vision is lost, it's permanent.
Yeah. And as you mentioned in your talk about glaucoma, the overview, you mentioned there are different forms of glaucoma. And can you describe what these are?
Yeah, so the most typical form is called open angle glaucoma. The eye produces a fluid called the aqueous fluid, the aqueous humor, which is used to nourish the front portion of the eye. This fluid then drains through an area called the drainage angle. And this normal flow allows the pressure in the eye to be stable. But if the drainage angle isn't working properly, the fluid can build up and the pressure can build up, and this can damage the optic nerve. Another form of glaucoma is called angle closure glaucoma. And this occurs when the iris or the colored portion of the eye begins to bulge, and that can close off the drainage angle. This is a medical emergency because sight can be lost very quickly. You'll experience headache, nausea, and severe pain in your eye and need to see a doctor immediately. Another type of glaucoma is called normal tension glaucoma. This occurs when the pressure is at normal levels, but we still see damage to the optic nerve. And some people believe that some nerves are a little more sensitive to pressure changes, or it may be related to lack of blood flow to the optic nerve due to conditions like atherosclerosis. And we can even see glaucoma in children. Some children are born with glaucoma due to blocked drainage angles, injury, or even underlying medical conditions. And the last type of glaucoma is pigmentary dispersion glaucoma. And this occurs when tiny flecks of pigment come off the iris or the colored portion of the lens and clog the drainage angle.
Okay. So, do we know the cause or the causes of glaucoma? And are there certain populations more at risk?
Well, the cause of glaucoma is the elevated pressure. We don't really know what causes the drainage angle to clog up. But once the angle does close, the pressure elevates, and that is the cause of glaucoma. But there's no other reason that causes glaucoma. Mm-hmm. And the people at higher risk are due to age. So anyone over 55 is at higher risk for developing glaucoma. African American and Hispanic patients have a 6 times increase in their development of glaucoma. If you have a family history, or if you suffer from a condition like diabetes or high blood pressure, you're at increased risk for developing glaucoma.
Well, concerning the symptomology of glaucoma, is there a typical progression that you may see in patients?
Yes. So in most cases, as we said, it's a silent condition. Patients don't even realize they're losing vision because it's so slow. You may start to develop small scotomas or holes in your vision that will eventually lead to a loss of side vision. This can lead to a tunnel vision where you're basically just seeing directly in front of you. And if left untreated, can lead to complete blindness.
Well, let's piggyback on that. What are the treatments for glaucoma?
So patients with glaucoma will have to take eye drops for the rest of their lives to try to lower the pressure. If eye drops don't work alone, then laser surgery can be done, which will help open the drainage angle. Some surgeons will even perform a procedure called a trabeculectomy, which causes a little flap to be formed that helps allow the fluid to drain into a drainage channel. And they can even insert a tiny tube into the eye to help drain the fluid.
So is there a cure for glaucoma?
Glaucoma cannot be cured, but early treatment can help prevent vision loss.
Yeah, and let's speak about that. What kind of prevention is out there?
Basically, the best thing you can do to prevent glaucoma is to get tested. Early detection is the best way to uncover any elevated pressure. Comprehensive eye exams can reveal the pressure, and treatment early is the best way to maintain any vision.
Right. Okay. As I said in the intro, January is Glaucoma Awareness Month. Can you discuss the importance of this to you and in general?
So the National Eye Institute projects that the number of patients in the United States with glaucoma will increase to 4.2 million by 2030. This is a 58% increase in the rate of glaucoma, and more than half of them will not know that they have it. This, combined with an aging population, can cause an epidemic of blindness to be looming. So early detection and treatment is really the only way to uncover glaucoma and prevent blindness.
And lastly, let's go ahead and I want to give you the floor for a few minutes and give you the chance to talk about the work of Lighthouse Guild.
So at Lighthouse Guild, we offer comprehensive vision rehabilitation to patients who are blind or visually impaired. And this comes through a myriad of services. So it begins with a low vision evaluation, which will help to maximize a patient's residual vision using high-powered glasses, magnifiers, telescopes, or electronic devices. We also help offer training in activities of daily living, which can help train patients to use these devices to perform activities that will keep them independent and active, like reading, traveling, returning to work and school. We offer mental health services to help patients deal with their vision loss. And we also offer services to family members and caregivers who are helping the visually impaired. In addition, we have a state-of-the-art technology center, which can help patients access phones, computers, and all sorts of adaptive technology that can help them function in their daily life. Additionally, we also have an adult daycare center for the visually impaired, which provides nursing services, occupational therapy, physical therapy, speech therapy, and helps the elderly visually impaired have a full active community.
Oh, sounds like you're doing some great stuff, and it's pretty wide ranging too.
It is.
Good stuff. And for people that are interested in the work of Lighthouse Guild, I'll go ahead and link to their website on the show notes of this podcast. And I want to thank you, Dr. Laura Sperazza, for sharing your time and your expertise, ma'am. Thank
Thank
you.
you so much.
You bet.
Okay, bye.